I'm Dr. Kenneth Barron from the Center for Advanced Gynecology, and I've had the great pleasure of being able to put together this video on pelvic floor physical therapy. I have a lot of patients who have gained a significant amount of benefit from going to pelvic floor physical therapy, but it can be a little intimidating and a little bit foreign to patients without knowing what it is. And so I was able to sit down with one of the masters of physical therapy in Charlottesville, Virginia, Silvey, who is with the University Physical and Occupational Therapy group, and she has been seeing a lot of my patients for a number of years. And so I sat down with her for about 20 minutes, and we've broken the interview into 2 sessions. And this first session goes over what physical therapy is and what you can expect sort of on your first visit. Welcome, Lauren. Thank you so much for talking with us. So the first question that I wanted to ask is, what is pelvic floor physical therapy, or what do you do that's different than a general physical therapist?
Well, thank you for having me today. I've been a pelvic floor physical therapist for about 12 years, and I've been a practicing PT for about 30. And pelvic floor physical therapy is a very highly specialized branch of physical therapy, and it aims to help men, women, and children with problems of the pelvic floor. So issues with urinary and bowel control, problems with acute and chronic pelvic pain, as well as pain with sexual functioning. And I do use my general physical therapy and sports background, sports orthopedic background every day when I'm working with my patients. The difference is that I have had very specific training in how to perform a pelvic examination and how to perform techniques that are very specific to the muscles of the pelvic floor, both from an internal and external standpoint.
When we talk about pelvic floor dysfunction, and there's a lot of different terms for this, and I often describe it as spasm or pain of the pelvic floor muscles. What are the symptoms that patients usually have when they're having problems with those muscles?
Okay. A pelvic floor dysfunction is a condition that affects the ability to normally use or control the muscles of the pelvis. So some of the symptoms that one may experience will be some urinary symptoms, so urgency, possibly some incontinence, pain with urination. Also, some bowel symptoms are very common, constipation, maybe some leaking of bowel, some rectal spasms are very common. And other complaints may be pain in the pubic area, pain in the lower abdominal region, pain in the genitals, extending all the way back to the rectum and into the tailbone. One may complain of low back pain, pain that radiates down to the hips, inner thighs, and to the buttock area. The spasm that you describe may be very painful and kind of a contracted, sort of involuntary tightening of the musculature that can be very uncomfortable. Also, I would describe other symptoms as maybe some numbness, tingling, burning, any of the nerve symptoms, and those could be more external as well of the genital area. And those are probably the main complaints. A lot of times women complain of not just one of those symptoms, but a whole variety of those at one time. And that's where it becomes very difficult to treat.
So patients can have pain with urination, and that can be not because the bladder is something wrong with the bladder, but because of the muscles that are in that area?
Definitely. Yes, definitely. I think the tricky thing about a pelvic floor dysfunction is that the musculature is very tightly and closely connected to the nerves and the surrounding organs. So when the muscles are tight or contracted or spasming, they speak to the organs. They share a common nerve supply. So the organs, the bladder may start to get irritated just from this nearby spasm of the musculature.
So what are some of the risk factors or the causes that can lead to these problems?
There are a lot of them. So I'll try to cover some of them. Let's see. I would say definitely, if we were to think of kind of grouping those causes into 4 different groups, infection could be a cause, a vaginal infection. It could start as a yeast infection or a bacterial problem. Inflammation, possibly with endometriosis, a flare of IBS, or some sort of disease process that's creating inflammation in the pelvic cavity. It could be a trauma, some sort of trauma to the low back, pelvic, hip area, and possibly after a low back injury, a hip surgery. Also, the stretch weakness of the abdominal musculature and the pelvic floor from pregnancy, a C-section, hysterectomy, just a general pelvic surgery. And then there are some other mechanical kind of muscular conditions that can also create problems. Chronic poor posture, very strenuous lifting when one is exercising or lifting something can cause also symptoms. And something just as seemingly simple as just chronic constipation over a long period of time can change what those muscles are doing down there.
So there's a lot of different causes, and some that are not so obvious, and some that that just develop over time. It sounds like.
Right.
When you see a patient that's been sent to you, like let's suppose I've seen a patient and I've determined that their pelvic floor muscles are very tender and they have pain with intercourse, and I send them to you. What can they expect in their first visit?
At that first visit, I find that I always do a very good, detailed, thorough history. I think that's one of the most important parts of our first visit together. Sometimes that first visit can last up to an hour, and we spend a lot of time talking about your symptoms, what caused your pain to start, what makes it feel worse, what makes it feel better, what are your goals for treatment, what would you like to be able to do better related to your quality of life? And so we always start with that. I think that's a great way to develop a good rapport with a patient and to familiarize them with what the process is for that first visit. And then I might move on and screen posture. I look at mobility of the spine and the hips. I look at flexibility, strength of your legs and your core. And then also look for tight, painful muscles throughout the core and the pelvis and the hips. And then if we have time on that first session, I go on to do a pelvic examination. And if we don't have time, we tend to do that the second visit. A lot of times, patients who are in pain can be very nervous about that part of my examination. So sometimes we just wait until the second day. And then when I do that pelvic exam, I'm not only looking at skin condition around the genital area, I'm looking for the strength, endurance, and coordination of the pelvic floor musculature itself, as well as looking for what the muscle tone is like. Are there spasms? Are there shortened, contracted muscles around the nerves? And then at the end of that first session, we talk about a plan, how many visits a week would be the best, and how long we should expect to go for. And I always include education, some sort of education as well in that first visit.
So after that first visit and the patient comes back, what sort of things or what should they expect in a follow-up visit?
So the follow-up visit is pretty comprehensive. I think a big part of that also is spent once again on education. We talk about possibly making some lifestyle changes related to diet that may be affecting some of the bowel and bladder symptoms that you may be having. We talk about definitely incorporating relaxation strategies into your daily routine, how to better manage your stress with some deep breathing, maybe visualization, maybe some more mindfulness techniques. And and trying to incorporate that into your general home exercise program. We also talk about possibly some urge strategies, what would help you to better be able to control your bladder during those times that you have some overactive symptoms and some urgency. So education is a big part of that. We also work on posture. What is the best way to sit at your desk at work? What are the different types of cushions that may be available for you if you're having pain when you're sitting? What could be an altered posture that you could try while you're sitting on the commode for constipation? So these are all things that we start with for education. I go on and I check flexibility, and then I give you a home exercise program related to relaxing the pelvic floor muscles, stretching the muscles of the trunk and the hips, and we also focus on some hands-on techniques is a big part of what I do. I use a lot of different types of manual techniques such as massage, trigger point releases, myofascial release, some general stretching, and I perform those techniques internally as well as externally to really get to those deeper and more superficial pelvic floor muscles. And then lastly, we spend quite a bit of time on neuromuscular re-education of those muscles of the pelvic floor. Our goal is to create better strength, endurance, coordination of the muscles, as well as incorporating that into how you move during the day. A Kegel is not always the most appropriate exercise to perform when you're first starting exercises. Sometimes we have to relax those muscles, teach those muscles to relax first before strengthening is appropriate.
Thanks for watching part one of this video series on pelvic floor physical therapy. That was the end of part one. Be sure to check out part two, which focuses on treatments and tools and resources involved in pelvic floor physical therapy and restoring pelvic health.